Hi, everybody. Ian Bremmer here. Start of yet another week. Hope you had a happy Easter. It is coronavirus for the foreseeable future. This feels like a potentially better week in a couple of ways. First, because it now feels pretty definitively like the healthcare system here in New York City is not going to get overwhelmed. There will be enough ventilators and related equipment for the average person that needs critical care with coronavirus to receive it. If that's true in New York with a much more substantial breakout, then I expect that with another couple of weeks, the second-tier cities should also get suitable support, both from states that have extra as well as from the federal government. They've had more time to secure it, which means we're not going to see northern Italy in the United States. And that's pretty good news, frankly, and we should really take it when we have it. Secondly, the fact that in Europe, in Italy, in Spain, we're definitely seeing that social distancing is making a difference. And in the United States, hopefully this is the week where we've really hit the peak in New York City. Certainly can't say that about the United States as a whole. But having said it, the fact that I've been here in New York and we feel like we're riding through and taking care of ourselves and sheltering in place, I think we should be grateful for the fact that it's not getting worse. So in that regard, it's a plus. I still feel like the developing market piece is the piece that has not hit yet and is going to be a very big problem. A very big problem because they don't have the healthcare systems. Their governance is considerably more uneven and not up to the quality of the United States or Europe. And because you can't socially distance even if you want to in many of these places. I mean, in Brazil, you got 25% of the population living in slums and favelas. In India, it's a lot higher than that. Sub-Saharan Africa, it's a lot higher than that, which means there's no way, even if you wanted people to shelter in place, that you wouldn't see explosive further outbreaks. And that means not only is the economic hit going to be worse, but also the ability to reintegrate the developing world into the supply chains of the West, reintegrate travel, is going to take a lot longer, at least until you get strong serology tests, you get some level of that, you're convinced that parts of the population have immunity and you can reintegrate them at least. And then, of course, eventually when you get a vaccine at scale. Sooner than that, here in the United States, we've got to start talking about what it means to start reopening the economy. And here, Governor Abbott from Texas did a pretty good job yesterday saying, I'm going to make a big announcement, an executive order about reopening the economy. Makes it sound like he's really on board with Trump. But of course, he hasn't actually said when or exactly how, which is smart because you don't yet have the medical experts on board with that. And so saying that you're in favor of reopening the economy and that you're definitely moving in that direction without giving anything too explicit lest you get caught out seems to be not the worst place you can be in. And frankly, from that regard, Governor Abbott in Texas and Governor Cuomo in New York, even though they sound a little different, their actual policies are perhaps less diverse and disparate than you might expect. This is important because, as much as the country is vastly divided over Trump, they are less divided over the people that actually implement the shutdowns. And here we're talking about the governors and the mayors. The vast majority of the country is locked down right now. The vast majority of the country will come out of lockdown on the back of science, on the back of what the doctors are having to say. Certainly, even some of the Republican governors are going to be much more cautious in the way they follow what Trump is saying in the next couple of weeks about when he wants to get the economy restarted. I certainly expect that in Massachusetts, in Maryland, in Ohio. The question will be, what do you do in the couple of states that really decide they do want to open and open significantly early, especially when that changes people's behavior and it gets them to socially distance less than they otherwise would? What happens when you get secondary outbreaks? And do you then shut it down? And if you don't, what happens to other states and how they respond to people that may be traveling from your state? We've seen horror movies about that kind of thing that could play out in a real inefficient inefficient and unpleasant way in the United States over the next couple of months. But in general, I think more coordinated behavior from the governors and the mayors now than is generally being portrayed in the media. The broader question is how you restart the economy, how you get companies restarting. And here, I've been impressed with the efforts that have been put in place by a lot of the CEOs. They understand that in order to get companies running again, there are a few things you absolutely need. First, you need clear medical guidance. So you need to understand from Fauci, from Birx, from others, that you've got the testing, you understand the immunity, that you have confidence that the healthcare system is suitable and the understanding of the virus is suitable that you can start opening up again. A second is you need measures for confidence around your workplace infrastructure. In other words, guidelines around things like cleaning and the availability of masks and hand sanitizers for employees, all of that kind of thing. In other words, we know that we have open plan in a lot of the country. How do you change that? And that's not all that hard to do, but it's expensive and it needs to be done in a coordinated way. And then finally, getting people into work, you've got to make sure that not only the workplace is safe, but also they've got public transport, that they've got, schools are open and daycare's open, and that the cafeterias can be open, and there's food supply for them in a safe way and healthy way on a daily basis. And the problem is that all three of these things were fairly clear about what we need to get the big multinationals up and running, but they're all being done by different parts of the economy. I mean, the healthcare, the medical guidance has to be done by the CDC and by the Institute of Health. And, the bits about getting the companies themselves, the infrastructure up and running, that can be done by the companies themselves. And getting people into work and having the public infrastructure around that, well, that's the cities and the states. And so until all three of those are in place, and they're obviously each of them is going to take a different amount of time, you can't really get these companies back up and running, at least not in a large degree. So I think that you're first going to be getting a degree of we can start to loosen lockdown. We can start to behave a little differently. We're moving in a different trajectory. And that's certainly going to feel better. But that's very different from saying the economy's now reopened. People are now playing a functional role. We don't have to worry about further relief efforts from the public sector, either in the U.S. or from other economies. And you can't really start talking about serious stimulus, getting the economy moving faster, until you're opening it up. All of which is to say that I really think that we're looking at contraction this whole year. I'd be surprised if we start to reopen significantly in a way that looks like growth, sustainable growth, even in fourth quarter. Maybe the end of the fourth quarter, you could start to see it. The country's going to start feeling better because we will have already hit bottom. But that's different from saying the economy's actually growing, and the impact that's going to have for so many members of the working and middle classes that no longer have productive things to do for a good long while is a real challenge. So anyway, that's a little bit for me. Fun thing coming up. My buddy Andrew Yang, who was early on universal basic income, but now everyone's talking about it, including folks like the Pope and the Spanish government. We're going to be talking a little bit later this week. I think you'll enjoy it. See you guys all soon.